The following video will give you a brief overview of home-based telehealth. We will start with an introduction to telehealth, and then review the current uses of home-based telehealth, introduce you to the equipment and software required for telehealth, go over the scheduling related to home-based telehealth appointments, briefly review how clinicians and providers can give feedback to the program, and finally, we will touch on patient registration. Telehealth is meant to simulate an in-person visit with your patient through use of video conferencing. Cisco Jabber is the software that is used, and calls occur in a closed, secure network known as the Health Information Network. Home-based telehealth is one of the provincial goals outlined in the Way Forward document. There are currently over 110 telehealth sites in the province, in various healthcare centers, clinics, and hospitals, including acute and long-term care sites. Within these sites, telehealth is delivered via secure live video. Because we are bound in the healthcare system by the Personal Health Information Act, we have privacy measures in place, such as encrypted network, firewalls, and password-protected software. There are two basic ways that we are able to connect using video. Physical telehealth devices located at healthcare sites. Examples include portable clinical carts, desktop units, and wall-mounted options for larger spaces. We also use encrypted software called Cisco Jabber. This can be accessed from a regional health authority computer or personal device such as a mobile phone, tablet, or laptop. We are now also able to connect to patients in their own homes. We use physical endpoints such as Jabber software and another web-based solution. Home-based telehealth allows the patient to attend a clinical appointment from the comfort of their own home or outside the regional health authority facilities. This service delivery option offers increased access to healthcare resources and reduces travel costs that may be associated with face-to-face clinic visits, training, and education. Some of the things to consider before starting to practice home-based telehealth are joining your call from a space that ensures the privacy and confidentiality of the patient. All providers should review the considerations for providing virtual care document that was sent in the welcome email. This document outlines privacy and consent items related to home-based telehealth. You should also identify the technical support that you may need prior to your call. Make sure you are aware of the processes involved in setting up the home-based appointment. For example, will you be scheduling your own appointments? Or do you have an administrative support staff member that can assist you with this process? Finally, you may also want to consider if anyone else in your office or area will need an orientation to telehealth. Please share this video with anyone at your practice that may benefit from orientation to home-based telehealth. Jabber is the secure encrypted software that is downloaded on the device that you will be using for telehealth. There is an online request form for providers to submit a request for a Jabber account. If you plan to download Jabber on a corporate or regional health authority device, your local service desk will assist you with this process. If you plan to put Jabber on a personal device, it is downloadable using a link for laptops and PCs or in the App Store for tablets and smartphones. The welcome email that you receive from the telehealth program will advise you to download Jabber on your device, include a Jabber user guide, and links to the Jabber training videos. These are also available on the NLCHI Virtual Care website. Once you review these videos, if you feel comfortable in your ability to use Jabber, you can email info.telehealth@nlchi.nl.ca to receive your sign-in credentials for Jabber. If you watch the videos and you feel that you need more training, please reach out to our team and request a virtual training session. Home-based telehealth can be used for individual appointments as well as for group sessions. Individual appointments and healthcare provider consultations are some examples. For group events such as treatment or education groups, home-based telehealth is a suitable option. In order to book a home-based appointment with your patient, an appointment must be created in iScheduler, the provincial telehealth scheduling system. Once the appointment is booked, an email notification with appointment details is sent directly from iScheduler to the patient and the provider. This email notification contains the information required for the patient and provider to join the telehealth call. WebRTC is a web-based platform that allows for the connection into the patient's home. When the patient clicks on the Join In link in the appointment email, they are joining the call via WebRTC or the web. Providers are able to enter the home-based call via the provider link. However, connecting via Jabber is recommended for a more consistent call quality. If the provider clicks on the link, as opposed to calling into the appointment via Jabber, they are entering the appointment via WebRTC. WebRTC can be accessed using selected browsers such as Google Chrome, Microsoft Edge, Firefox, and Safari. The patient connects to the call by clicking on the Join In link in the email that they receive. They can do this from their personal device at home. However, the provider has a number of options to connect to a home-based telehealth call. The options are listed here: Jabber or WebRTC from a personal device, Jabber or WebRTC from a regional health authority computer, dedicated telehealth unit in a regional health authority facility or private practice clinic. There are some patients and clinical scenarios that are not well suited for home-based telehealth. Again, we encourage you to review the considerations document in the welcome email. This document outlines patient selection and preparation, as well as privacy and consent items related to home-based telehealth. In order for your patient to be able to participate in a home-based telehealth call, there are a few things that should be considered. First, they will need a device that is capable of audio and video. This could be a smartphone, tablet, or a computer with a webcam, microphone, and speakers. An internet connection that has sufficient bandwidth to complete the video call is also important. They must use a supported browser when connecting to the call. The supported browsers include Google Chrome, Safari, Microsoft Edge, and Firefox. If all of this is in place, prior to connecting for a live appointment, it is recommended that the client do a quick device check to ensure that their internet is capable of supporting a video call. The administrative staff member or provider should ensure patient readiness prior to the initial home-based appointment. Prior to a telehealth appointment, it is important that the patient is prepared to participate in the call. Please review the document titled Joining Your Call and ensure that this document is sent to the patient prior to participating in a home-based telehealth appointment. This document contains a link for the device check. This is a very important test that the patient should complete, as it helps to ensure that the patient has adequate internet speed to participate in the home-based telehealth call. A link for the device check can also be found on the NLCHI home-based telehealth resource webpage. The provider is not required to test their device. Supported devices include Android tablets, Android smartphones, iPads and Apple iPhones, laptops, and desktop computers with audio and video. Please refer to the Joining Your Call document for further details. All telehealth appointments in the province, whether from healthcare site to healthcare site or home-based, are scheduled through a provincial scheduling system known as iScheduler. Requests for home-based telehealth appointments are submitted electronically via the direct booking process. This allows for immediate booking of home-based appointments. When home-based appointments are submitted, the provider can choose to either receive an email notification with the appointment information or use the appointment whiteboard report to receive dialing information. The appointment whiteboard report lists all patient appointments and dialing information for the day. Please ask your administrative staff member to send you this report, as they have access to these appointment report details. Here is a sample of what the appointment whiteboard report looks like. The dialing information that you would add into the Jabber call bar is highlighted in red. For example, 1901353 at meet.healthenl.ca would be added into the Jabber call bar. Please be advised, the appointment whiteboard report can only be emailed to a provider if both the sender and the provider sharing the report are using secure Regional Health Authority email addresses. Please ensure that there are no patient identifiers in the heading of the email. Please do not send this report electronically to a clinician through any other means. The requests for individual home-based telehealth appointments can be processed immediately through the direct booking process. There is a reference guide and training video to help with the steps involved in this process. The person scheduling at your site will receive training in this booking process. Any telehealth call that involves a telehealth unit at a regional health authority site will need to be booked differently than a home-based visit. If you work within the regional health authority, you will have access to the directory, which lists dialing information for all sites in the regional health authority. Calls to other regional health authority sites must also be scheduled in iScheduler. Please do not call into a regional health authority site unless it has been scheduled appropriately. For more information regarding the site-to-site booking process, please contact your regional telehealth coordinator. The patient's email address is required in order to book a home-based telehealth appointment. It is important that the provider or administrative staff member collect the patient's email in order to book this type of appointment. When you schedule a home-based appointment, this is the email notification that is sent out from iScheduler. The email notification has information for both the patient and provider. At the bottom of this email, there is also a link to a survey where you can provide feedback after your call. If you would like to have a group treatment, education session, or meeting, you can forward the email notification or link to all participants. The participants will click on the link to join in the call. If the Join In link in the email notification does not work due to a browser issue, participants can copy and paste the provider link into a supported browser to join the call. Likewise, if you are a resident and would like your supervisor to have the ability to join your home-based call with the patient, you can forward this notification or your appointment whiteboard report to your supervisor. Your supervisor can simply click the Join In link or copy and paste the provider link in a supported browser to join the call. As mentioned previously, there are home-based resources for patients and providers on the NLCHI Telehealth website, such as Joining Your Call for Patients. There are also patient handouts about what home-based telehealth involves for patients considering this type of service delivery. The provider survey is located on the resources page discussed on the previous slide and at the bottom of the appointment notification email. Because home-based telehealth is a relatively new process for us all, we want to be sure the resources and processes developed are appropriate and effective. Please provide us feedback to help make this service better for patients and other providers. Please refer to your program for direction regarding registration processes for telehealth patient appointments. During this process, the patient and the healthcare provider may need additional support to ensure that they are ready for the telehealth call. If you or your patient are having difficulty during a telehealth call, please contact the technical support team. If you are having difficulty scheduling an appointment, please contact the scheduling team at NLCHI. We realize that there are sometimes hurdles with adopting new processes and technology. However, the benefits of adopting home-based telehealth are significant. Please let the Regional Health Authority Telehealth Coordinator know when you come across a hurdle or roadblock. We will all work together to find a solution. Thank you. Please reach out to the telehealth coordinator in your region if you have any questions regarding this presentation.